In 2023, the United Kingdom recruited 11,966 nurses from Africa. 11,966 health personnel trained in African universities, paid by African governments, desperately needed in African hospitals. Gone. And that's just nurses, just the UK, and in just 1 year. When we add doctors, engineers, scientists, teachers living for Europe, North America, the Middle East, we are talking about the greatest transfer of wealth in human history. Except nobody calls it that. Here's what I need you to understand. Every single year, tens and thousands of Africa's brightest minds pack their bags and leave. Doctors, nurses, engineers, scientists, university professors, ICT specialists. And here's the part that should make you angry. Most of them, we train them. African governments invested years. 4 years for nursing, 6 years for medicine, and sometimes even more for specialists. Built the universities, paid the professors, subsidized tuition. We spend anywhere between $50,000 to $200,000 training a single doctor. And then they graduate, work maybe 2 years, and they are gone. But here's what makes this even worse. The countries losing the most, they are the ones that can least afford it. Let me show you what I'm talking about. In 2022, Zimbabwe only had 3.5 doctors per 100,000 people. The World Health Organization says you need at least 23 of them for a well-functional system. Zimbabwe has 3.5. You know why? Because 80% of the graduates from the University of Zimbabwe in the last decade left. They are in UK, Australia, Canada, New Zealand, and you name it. Nigeria, the country trains doctors almost more than any other African country. Over 400 medical schools and teaching hospitals. In 2022 alone, 1,226 Nigerian trained doctors registered with the UK's General Medical Council. 1,216 in 1 year. Between 2016 and 2022, Ghana lost almost 60% of its doctors to immigration. Kenya, similar story. Nurses, doctors, engineers, living faster than universities can replace them. And it's not just healthcare. Ethiopian engineers designing buildings in Dubai instead of Addis Ababa. Kenyan software developers writing codes for Silicon Valley instead of Nairobi. South African scientists researching in German labs instead of Johannesburg. Every one of them trained in Africa, needed in Africa, but working somewhere else. But here's the question nobody wants to answer. What does it really cost Africa? Most people think about brain drain in terms of numbers. How many people left? That's not the problem. The real issue is what happens to those people who stay. Imagine you're a doctor in a public hospital in Harare, Douala, Nairobi, or Lagos. You are handling 100 patients when you should be seeing 30. Working 18-hour shifts because there aren't enough doctors. Using equipment that's outdated because there's no budget for new machines. And worst of all, getting paid a fraction of what your classmates earn in London. And every month, another colleague hands in their resignation, which means your workload just got heavier. So what do? You start looking at those recruitment emails too. It's a death spiral. Poor working conditions make people leave. When people leave, conditions get worse, which makes more people leave, which again makes conditions even worse. And while this is happening, people are dying. The World Health Organization estimates that Africa carries 25% of the world's disease burden, but that's only 3% of the world's healthcare workers. 1/4 of the world's health problems. 3% of the world's health workers. That much doesn't work. You know what does work though? The recruitment agencies. Let me show you how this game is really played. After COVID-19 hit, Western countries had a problem. staff shortages, burnouts, healthcare systems overwhelmed. So they did what they always do when they need something. They came to Africa. Sign-on bonuses, fast-track visas, relocation packages, housing assistance. Now, I'm not saying these offers are bad for the individuals who take them. If you can triple your salary and offer your family a better life, I understand. But let's be clear about what's happening here. Western countries are recruiting trained personnel from countries that spend scarce resources training them. Africa pays for the education and the West gets the workers. That's not migration, that's extraction. The UK has something called the NHS International Recruitment Program. They literally have a department dedicated to recruiting healthcare workers from developing countries. And they target specific countries: Nigeria, Ghana, Kenya, Zimbabwe, Cameroon, Philippines, and India. Countries that have health worker shortages themselves. Now, the WHO created a code of practice in 2010. Said countries shouldn't actively recruit from nations with critical health worker shortages. It's voluntary and nobody follows it. And even if they did, here's what makes this complicated. If you are a 28-year-old doctor in Lagos making maybe $400 a month, and you get an offer of $5,000 to $6,000 in London, modern equipment, reasonable hours, what would you do? I'm not judging the individuals who leave. That's not the point. The problem is the system that creates this choice in the first place. African governments underfund education and healthcare, don't pay professionals competitive wages, let infrastructure collapse, ignore working conditions, and they act surprised when people leave. But Western countries aren't innocent either. They talk about helping Africa develop while running recruitment campaigns that undermine that exact development. You can't build a decent health system when you are constantly losing doctors. Can't build a sustainable tech industry when your programmers move to San Francisco. Can't build infrastructure when your engineers design buildings in Dubai. And here's the tragedy. We are not even talking about this honestly. So let me be honest. This is a form of wealth transfer. When a country spends $200,000 training a doctor and that doctor works 30 years in another country, that's not just a lost doctor. That's lost investment, lost tax revenue, lost economic contribution, lost innovation. Some estimates put Africa's brain drain cost at over $4 billion every year. So what's the solution? Some people say close the borders, stop people from leaving. That's not realistic and it's not right. Others say African governments need to pay competitive salaries. True, but where does a country like Zimbabwe get the money when its economy is struggling? The answer isn't simple, but here's what could work. 1. African governments need to massively improve working conditions, not just salaries, equipment, housing, professional development, respect. 2. Create incentives for diaspora professionals to return, tax breaks, research grants, leadership positions. 3. Build partnerships where skilled workers can split time between Africa and abroad. For example, 6 months here, 6 months there. 4. And this is important. Western countries that benefit from African talents should compensate the countries that trained them. You want the doctor? Fine. Reimburse the tuition fee or the university that trained them. Will that happen? Probably not. But we should at least be honest about what's happening. Here's what I keep coming back to. We send remittances home. $100 billion a year. That's beautiful. That's love. That's solidarity. But money can't perform surgery. Money can't teach a classroom. Can't design a bridge. Can't develop a vaccine. So we need to understand that skills matter. Presence matters. The African diaspora is incredible. Accomplished. Contributing to the world. Just imagine if even just a third of that skill or talent was building in Accra, in Nairobi, in Lagos, in Kigali? What could Africa build? This is not about blaming people who left. They made the best choices with the options they had. This is about changing the options, making it possible to build a career in Africa without sacrificing your family's future. So here's what I want to know from you. If you're part of the diaspora, what would it take for you to move back or even consider it? And if you're in Africa watching skilled people live around you, what do you think would actually make them stay? Because this conversation, this is just the beginning. Africa's greatest resource isn't gold, oil, or diamond. It's the minds we keep losing. And it's time we figured out how to keep them home. That said, thanks for watching this video, and I hope to see you on my next one.